Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about rickets. Okay. From rickets, you are getting a short note. From rickets, you will be getting a short note. So prepare this topic in such manner that you will be getting a short note. Now, rickets is basically a childhood disease. Okay, rickets is basically a childhood disease. I have already told you rickets has I and C in their spelling, and I represents infants and C represents children. See, it's not the full form that I am telling you. I'm just trying to tell you a mnemonic by which you can remember, because in the bone mineralization defect, you have two types. In adults, AA, it is for osteomalacia, and then in children's, C, you have rickets. Okay. Next, so rickets is a childhood disease characterized by there is defect in the mineralization of growing bone. Okay, so there is a defective mineralization of the growing bone that you are able to see. How does the normal bone develop? So I hope you know something called as a diaphysis. Then you have epiphysis, metaphysis, and you have a growth plate. So when there is a defect in your growth plate, you are able to appreciate this kind of defect in the children's, right? So what are the nutritional deficiency that leads to rickets? First one, there is vitamin D. Because we all know that vitamin D is essential for the calcium absorption. It is essential for the calcium absorption. Next, you have is the calcium. Calcium is why it is important. Calcium is essential for the bone strength. It is essential for the bone strength. That is why it is advisable either to take the vitamin D supplements or either to have 1 glass of milk every day. Next you have is the phosphate. What does phosphate do? Phosphate supports the bone mineralization. Okay, phosphate supports the bone mineralization. Next, so you have certain genetic causes also. Okay, although genetic causes are not that important. What are the risk factors? First one is the sun exposure. I have already told you that you have to ask that patient that you will not get tan if you didn't get the proper exposure to the sunlight. For sure you will be developing osteomalacia, and if that is the children, he will be developing rickets, right? So there should be a proper amount of sunlight exposure, right? What happens is when there is limited sunlight exposure, that leads in the vitamin D, that leads the decrease in vitamin D synthesis. Next, when there is inadequate nutritional intake, right? Like the patient is not having the essential nutrients that are required for the body. Let's talk about the pathology. So rickets is characterized by a defective mineralization. There is a defective mineralization of the growth plate leading to the alteration in the bone structure. After that, what happens is there is accumulation. There is accumulation of unmineralized osteoids. See, if you are not getting the pathology right now of this, because I have already explained you that in the session of your osteomalacia. If you are thorough with osteomalacia, then only watch the chapter of rickets, because they are interlinked to each other. Okay. Next, then what happens is, after that there is bone deformity. After that, there is bone deformity, and the child will complain of pain. There will be pain in the hip, vertebrae, and the wrist. These are the classical areas where the child will complain that, doctor, I am having the pain over there. Okay. Next, what are the radiological images? So you have, when you do a X-ray, you will be getting a classical features. There will be cupping and there will be fraying. These two are the classical things which you will be able to appreciate when you do a X-ray. Okay, so you will be able to appreciate the CF. What are the CF? You will be able to appreciate cupping and you will be able to appreciate fraying. Okay. Next, there will be bending of legs. In some cases, there will be bending of legs, which you will be able to appreciate. Okay. These are the clinical features. First one is, there is bowed legs. See, this leg you are able to appreciate. These are bowed legs. Okay. So, they are characteristic deficiency caused by the weakening of the bones. It is due to the weakened bones. Okay. It is due to the bone weakening. Then you have the dental problems, like there will be delayed tooth eruption. There will be a lot of time the tooth will take to come out, right? Then there will be dental enamel defects. And then there will be growth delays. There will be a slower growth rate as compared to the people who are of the same age. In the growth plate, we are able to appreciate there is defective mineralization and it is observed at the growth plate regions. Next, there is skeletal deformity changes. There will be weakness of bone structure. And bone density, if I talk about, the bone density will be less, obviously, right? Next, what are the diagnostic procedure? Firstly, you have to take the history of the patient. You have to take the history of the patient. A very thorough history should be taken. Then you have to do the physical examination of the patient. You have to check the density of the patient, not the patient, the density of the bone. Then you have to take the laboratory values. In the laboratory values, the vitamin D, calcium, and the phosphate will tell you what exactly the problem is there, right? If I talk about the treatment and management, so you have to take the proper nutritional supplements. There should be a proper nutritional supplement. Vitamin D should be taken properly. Phosphate should be taken properly, right? There should be a regular monitoring. There should be a regular monitoring to check that these all things are going on properly. Just like your mother keeps a check on you every single day that my child is not doing anything wrong, similarly, you also have to keep a check, not just on yourself, but also with the patient that you are dealing with, right? Next, you need to know about the importance of early diagnosis. I have already told you that prevention is very, very, very better than cure. Prevention is better than cure. So you have to prevent a long-term complications, because if the complication will occur, if there will be bowed legs. Okay, I understand that the bowed legs will be corrected, but there can be multiple fractures that can happen to the patient, that can happen to the child, right? And it can be very dangerous to the child. So you have to treat the patient in order to avoid the complications, right? Then you have to understand their pathology and the clinical features, and you have to educate the parents as well about this disease, right? So this was all about this chapter. I hope you understood this chapter very, very well. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.